Bringing you the health department's press conference live from their Facebook page since the governor has gone to the White House. We apologize for any glitches, but do feel it's important to share the information, though we chose not to be there in person. Let's listen in.
Total for today is 5,003. That's the total cases from the beginning. Of those, 1,044 are active cases. Of those active cases, 85 are from a nursing home, 315 are from correctional facilities, and 644 are within the community. We have no new counties for today. Our hospitalizations are currently 79. That's a net increase of 1 from yesterday. We have 16 on a ventilator. That's an increase of 2 from yesterday. And we have had 5 additional deaths. So we are at 107 total deaths. 4 of those 5 were nursing home residents. Our total recovered is 3,852. That's an increase of 113 from yesterday. So we've actually had more people recover in the last 24 hours than we have new cases. Let me go ahead and go over the slides. And unfortunately, the way it's set up, I can't really see them. I think, and you can let me know, Naveen, I think what we have is the number of new COVID-19 cases in Arkansas, the usual slide that we see. You can see we have a slight decrease from yesterday. Let's go to the second slide. The second slide shows basically the same thing with our 7-day rolling average, and you can see the 7-day rolling average is pretty much plateaued out for us for right now. I'd like to go with the third slide, which is our cases. You can see we had a peak, then a trough. It's come up, and now it's plateaued off again. Actually, a slight decrease from yesterday, since we had more recovered than we had new cases. The next slide is a map, and it shows where our total cases are. And you can see the 5 counties that have the greatest number of total cases are first Lincoln County, and that is due to the Cummins unit COVID-19 outbreak. The next is Pulaski County, which is really just because of its population size. We have Jefferson County. Part of that is the outbreak at the Randall Williams unit, but they've also had they were the place where we had our first case, and they've had a number of cases there over the last couple of months. We have St. Francis County, and that is mostly from the FCI there. And then we have Crittenden County with 250. And again, they've had a large number of cases, largely related to their proximity to Memphis, which is has quite a few cases and a high population. Let's go with our, well, before we leave that, I'd like to go over of our community cases, our 79 community cases, what counties they're coming from. We don't have any counties that had a lot of cases in the last 24 hours. Only one had 10 or more. That was Pulaski County. Pulaski County had 10 cases. Crittenden County had 9. We had 7 in Yell County and 7 in Benton County. And we had 6 in Craighead, and all the other counties were 5 or fewer. The next slide is the number of currently hospitalized COVID-19 patients. And you can see, like our active case numbers, we had a peak, a trough. It's risen a little bit and has more or less plateaued out. I'd like to talk about testing. If you can go to the next slide, the number of COVID-19 tests that we've had, and I'm very happy to say that we had had our record yesterday with over 3,000 tests in a single day, and yesterday we broke that again with 4,396 tests. So you can see a big spike there. Of those tests, 1.9% were positive. So still a relatively low positivity rate. If you can show the next slide, this shows our progress towards our 60,000 for the month. We're at 44,240, so we're well on our way to not only meet the 60,000 target, but to exceed it. since the beginning of our testing for COVID-19, we have tested a total of 95,010 individuals. And again, these are not just positive tests, these are individuals because these numbers are deduplicated. The last slide I'd like to show is showing our positivity rate as a trend, and you can see that we have had a general downward trend there, although our positivity rate has been low for the last couple of weeks, and it's hard to get much lower than 2%. I'd like to, I think that's our last of the slides, but then we have the tableau. Can you put that up? We want to make sure that we're getting these data out to the public, to where any member of the public can see the numbers as easily as possible. And so we have a new website, or new place on our website, a dashboard where we can display some of those numbers. And I can't see it because of where I'm standing, but hopefully you can see it. Quite a bit of useful information. And if you click on some of these things, you can get even more information. And I have Donald McCormick, who has been pivotal in putting this together, and he's here and available to answer questions when we get to the question time. The last thing I would like to talk about is safe work sites. We had some questions yesterday about work sites, and I want to point out that safe work sites are essential for our economic recovery. Businesses have to stay open. To do that, they have to have workers coming in, not being afraid that they're going to be infected, and they have to have, if they have customers as well who come onto their site, their customers also have to be confident that they're not at risk of infection. And so safe work sites are an essential part not only of controlling COVID-19 spread in our communities and saving lives, but also a very important part of our economy recovering from the impact of COVID-19. Work sites are, of course, a risk. Many adults spend more time at work than they do in any other single place when they're awake. Of course, hopefully they're sleeping at home, but their coworkers, interactions with coworkers, those are opportunities for COVID-19 to spread, and that's why it's important that those safeguards be in place. For that reason, we've put out a number of directives and guidances to businesses in general, but to specific industries. Some of these directives seem somewhat restrictive, and at times we've had complaints, but these are really all designed to make those work sites safer, to protect both the people working there as well as the people who come in as customers. And they are a bit restrictive. They're not the way we normally do things, but these are really important, not just for protecting people from getting infected with COVID-19, but also for our economy to recover by making those work sites safe. The other thing that we do is when we do have COVID-19 transmission at a work site, we work with those work sites to do case investigation, contact tracing, so we can quickly get them back and going, make sure that the workers are as safe as possible, as well as their customers. And what I'm going to do is ask Dr. Jennifer Dillahay, our state epidemiologist, to come up and talk a little bit about the sorts of things we do when we partner with those work sites, places of businesses, to either bring COVID-19 spread under control, and also to make it a safer place for all those in the work site. And Dr. Dillahay, if you'd come up.
Thank you, Dr. Smith. So I thought what would be helpful would be to review what happens when a person is positive for COVID-19. So suppose they developed some symptoms and they went to their doctor and their doctor tested them, and the test showed that indeed they did have the virus that causes COVID-19. So the positive test is reported to the Arkansas Department of Health, and then the patient is contacted by a nurse and they're interviewed. And part of the interview is to learn about when did they first develop symptoms, because we're interested in learning when their infectious period was. So we take that from the day they develop symptoms, and then we back up 2 days, because the thinking is that people can spread the virus when they're pre-symptomatic, during the couple of days before they actually develop symptoms. So the nurse would interview them and learn about who is in their household that might have been exposed, and then they ask about where else they have been. If they work, they learn where they are employed, and then we contact the employer to make sure that the close contacts at work can be identified and tested and excluded from work, because they need themselves to be under quarantine. There are some situations where if a person is in a position of critical infrastructure or an essential worker, it's possible they may continue to work. So the health department works very closely with employers to work with them to identify the contacts of the sick employee, and then to assess the exposures and where the employee worked, what shifts. If they're in manufacturing, they look at who's on the line, who they interacted with, where the breaks were in terms of the break rooms, and who would have interacted with them. And then we work with them to screen their employees. Now, one of the important things that we also do is we work with employers to help them prepare their setup where their office is, or their plant, or whatever the workers are doing, whether it's manufacturing or food processing, so that the processes they have in place can be constructed or arranged in such a way to reduce the possibility that transmission would occur to other employees if someone is sick and they don't know it yet. So, for example, in many food processing, manufacturing places, employers have arranged the workers so that they have more distance between each other, or if they're on a manufacturing or conveyor belt, that they're not facing directly someone. If that's not possible, then oftentimes they'll put a plexiglass sheet to prevent spread across the line or between workers. The health department is very willing and able to assist employers of every kind to assess their work situations, to optimize the physical layout and arrangements, how they staff, and the timing of the staff coming in and out. But it's also very important for employers to screen their employees so that those who arrive at work are known not to be sick at that point in time. And those who are sick, they should have liberal policies to allow people to take sick leave so people do not feel compelled to work when they are ill. And I want to emphasize that we go through these processes with employers because our goal is to keep the businesses open to if there's any way possible. We work with them if they have essential employees that may have been exposed but still need to work. And we also work with those who have out-of-state travelers who come to Arkansas that need to perform certain business functions with their business, and to make sure that those out-of-state travelers don't bring illness into their facilities. So there's a lot of ways that we can work with businesses to approach the situation and make it possible for them to stay open and yet at the same time reduce the possibility that COVID-19 could be spread in their facility. So I'm going to stop now. Thank you.
Thank you, Dr. Dilhay. Some of the work sites that we have are congregate settings, like prisons or nursing homes, other long-term care facilities. We have a special team. Actually, we have two teams that have special training in working with those facilities to limit the spread of COVID-19 and make them safer. And I've asked Dr. Naveen Patil, our medical director for infectious diseases, to come up and talk about their work. He leads those teams in those efforts. So, Naveen, please come on up.
Good afternoon. Thank you, Dr. Smith. I am here representing the Healthcare Associated Infections team at the Arkansas Department of Health, which has been tasked with, helping out congregate settings. When I mean congregate settings, that includes nursing homes, assisted living facilities, prisons, drug and addiction centers, human development centers run by DHS, and other behavioral and psychiatric facilities. So we've been helping all these facilities over the past 10 weeks. An important part of our program is both at prevention and control of clusters of infectious diseases in these congregate settings. And our recommendations have been incorporated in these activities of both prevention and control in these facilities. So to go back a bit, infection control improvements and training, that includes both training and outreach statewide, have been going on for the past few years at the Department of Health as part of our Ebola grant funding that we received from CDC after the Ebola outbreak, and also due to the strong support by Dr. Smith here and the ADH leadership to focus on those efforts. As part of that funding, our team here at the Healthcare Associated Infections Program has visited over 200 facilities statewide before the Ebola outbreak, and that included about 75 nursing homes and a majority of the hospitals in the state. What this investment in all these visits have allowed Arkansas to respond and engage quickly after COVID-19 because of all the background work that has been done over the years. After COVID-19, in the past 10 weeks, our team has visited about 50 facilities that have been affected by COVID and helped them guide in infection control and prevention at these facilities. In the coming months to years, we plan to visit all these facilities if possible. If not, the other option we have is to provide infection control efforts to all these facilities in the future. One of the other major aspects of Arkansas that we are all proud of, and for which other states and including national bodies have reached out to, is Arkansas was the early adopter of facility-wide testing in congregate settings and aggressive infection control measures. This was built on our relationships that we already had with Arkansas Healthcare Association, Arkansas Hospital Association, strong collaboration with our State Public Health Lab, Office of Long-Term Care, the VA Hospital, the Department of Corrections. What we have done is built upon these relationships. And whenever we identify a positive case, whether it be a resident or inmate in these facilities or a staff or healthcare worker, our goal is to respond immediately. And within 24 hours, our goal is to test everyone in that facility. As soon as that testing is done, our goal is to have the results coming in within 48 hours, and by 72 hours, the whole process is completed so that we can then guide the facilities on better guidance on isolation, infection prevention, and other strategies that can limit the spread of that infection within that facility, be it a nursing home or jail or prison. All our partners, nursing homes, jails, prisons, they've all been compliant in this. This represents, honestly, thousands and thousands of hours of work by all our partners, and we are very proud to have such a strong workforce here in the state. I'm particularly proud of all our nursing home staff. I remember them driving through here middle of the night, early in the morning, coming here to collect specimens, go back, get their residents tested, and drop it off at the lab when we had limited testing services. This sort of commitment and care for their residents is unmatched. We are very proud of that. I'm also very proud of our very small team. As Dr. Smith alluded to, we are 8 people who have done all this work. That includes thousands and thousands of tests being delivered and resulted out. And my team, I would like to appreciate Ms. Kelly Garner, who's the backbone of the team. Ms. Pamela Higdem is the most experienced infection control person in the state. Having such a strong team that is looked upon by national partners and other states is a blessing for the state of Arkansas. I would also like to thank many of our wonderful partners who have helped limit the spread of infections and control the mortality and morbidity in the state, including Ms. Rachel Bunch from Arkansas Healthcare Association, Dr. Katie Seeley from the Public Health Lab, Dr. Toys from the VA Lab, who have been helping out, for us regarding testing, Secretary Wendy Kelly and Director Payne from the Department of Correction. They have, given us access to everything that we need so that we can help prevent control of outbreaks in Arkansas prison system. Finally, I have a word of caution and advice for everyone who's involved in the state, is that we play our part to protect our loved ones and those at highest risk. As we continue to open the state, hope we continue to practice social distancing, masking, and hand washing as we move forward in future care of our patients. Thank you.
Thank you, Naveen. Let's go ahead and open it up for questions.
Any reason for the big increase in testing over the past day? It seemed like a pretty big jump.
Well, we've been emphasizing this for quite some time, and I think all the pieces are starting to come together. The biggest increase was from our commercial labs, so these are people collecting specimens, sending them off to commercial labs, getting those results back. And remember, the results that we're getting today were probably collected a couple days ago. So all this, the message about increasing the testing, increasing the populations that we test in, I think that's getting through. We're hoping that we'll increase even more. We have a high throughput instrument that we are working to get validated in our lab, and that will allow us to greatly increase the contribution from the public health lab, the Arkansas Department of Health Public Health Lab. And Arkansas Children's Hospital also has a high throughput instrument that they are bringing online, and those will also enhance our capability to do those through the public health lab and through Children's Hospital as well.
Is there a certain industry that you guys have noticed that's maybe a little more at risk beyond the congregate setting?
Well, there are certainly industries that we've been watching closely, that have been watching themselves closely. I think the meat processing, food processing industry, particularly poultry, is such an important industry. They've been watching very carefully, and so we've been working with them on that. We have had over 100 workers. Only about half of those are active cases now, but that's an area where we've been looking very, very closely. I think from our visit to Forest City earlier this week, that brings to mind the Belleville Boot Factory, where they had a cluster of cases as well. Any employer where there are a number of workers together in the same building, there's potential risk there, which is why we really encourage businesses to adopt the guidance and the directives that we've put out there, and to be vigilant and try and keep those workers who are sick, let them stay at home. Don't unintentionally create incentives for sick workers to come in.
So were some of these places that you've seen that have kind of flared up a little bit, were they not putting anything into practice, or is it just sort of happens?
Well, the challenge with COVID-19 is that we now know that asymptomatic, pre-symptomatic transmission can and does occur. And so even if all your workers have no symptoms and they have their temperatures checked, you could still have transmission, which is why even though we check temperatures for people coming into this building, we still wear masks for source control.
Dr. Smith, this is Cole with 4029 News. Is the team sports and camp news delayed, and when should we expect to hear that?
Can you repeat that question again?
Team
Sure.
sports
Is the team sports and summer camp news delayed, and when should we expect to hear that news?
Yes, originally we were planning on announcing that today, but since the governor is out, we're going to announce that tomorrow. Does that answer the question?
Yes, sir. Thank you.
And for the overnight camps, we've already communicated some of those important dates to the industry to give them time to prepare. But we'll go ahead and make those announcements tomorrow, both about team sports, summer sports, as well as the overnight camps.
Has there been a workplace outbreak in Dardanelle?
In Dardanelle, Yes, there was I have some information on that. That was at a poultry-related industry, and I want to make sure that I get the name correct. So give me just a moment. Nebo Poultry in Dardanelle and Russellville. Yes, they've had 14 active cases, is the information that I have.
On the workplace issue, I know Dr. Akil was talking about things that happened before the COVID outbreak, but on a sort of a proactive basis, is there anything that happens to like go in and look at the meat processing plants or factories or whatever and make sure that they are set up in a safe way?
For our large industries that are multi-state, they oftentimes have their own teams and they have their own systems in place to address those. Of course, we're available for consultation. For the smaller businesses who don't have that in-house capacity, we certainly are available for consultation to help them look at their systems and implement the guidance and directives that we put out there.
Dr. Smith, Neil Gladner in Hot Springs, if I could ask you a question about courts, please.
Sure.
The Supreme Court, as I understand it, issued an order some time ago telling the courts to follow health directives, and there's some question from the courts about which the directives they should be following. Is there, or will there be specific guidance for the courts? Is it 1/3 of their capacity, 6-foot distancing, those sorts of things? Can you provide some counsel there?
Well, yes. There are some industries, if you call courts an industry, if there are some sectors that don't necessarily exactly fit in to the general guidance. In the particular case of the courts, our Supreme Court, for example, our state Supreme Court, what we opted to do was to do a consultation with them where we had one of our medical advisors and our chief counsel, who understands the court system, work with them to develop some specific guidance for them rather than try and create a separate directive for them. When there's a need to make a directive, we do, but if there's the opportunity to work directly with that sector, then that's another option.
What about for the district courts and the circuit courts?
I would hope that they would really follow the same pattern. But if there's questions or concerns, we are available to work with them.
Have you been able to recruit more people to the contact tracing team?
We are, yes, the short answer is yes, but we have realized that our next step really is to utilize volunteers, but we really have to have people who have that special training who will be with us over the duration of this pandemic. And so we will be presenting a proposal to the CARES Act committee to basically stand up those contact tracing efforts to move from an emergency response to more of a sustained response.
Dr. Smith, you mentioned there were some important dates that you gave to the campus industry. Are you able to share those with us today?
What I can do is have Meg Miracle, our communications director, share that with you. I don't have those right with me. And of course, they'll be announced tomorrow as well.
Thank you.
Going back to the dashboard, I don't know if prisons are included on there, and if they're not, could you give an update on like the 2 or 3 major ones that we've had as far as number of cases, etc.?
Certainly. The prisons, the main ones that are that we've had recently is of course the Cummins unit. The total on that is 951 inmates. We've not had any since yesterday. We had 65 staff at that facility. The Randall Williams unit in Pine Bluff, total of 231, no new from yesterday, and a total of 15 staff. The FCI, Federal Correctional Institute in Forest City. They had extensive testing done last week by CDC and Bureau of Prisons. We're still getting some of those results rolling in. We're currently at 609. That's an increase of 24 from yesterday, and we're still at 17 staff there and 1 contractor. Again, because some of the labs that they used for those testing take a little longer, we haven't gotten all the results back, but so those numbers may increase a little bit, but all the testing is done as far as we know.
Are those active numbers or are those total numbers?
Those are total numbers. Not all of those are active because that investigation's been going on for more than 4 weeks. Other questions remotely? And I'm looking at the back. The lighting is a little bit difficult. I see a masked figure. Is that Senator Irvin there? Well, welcome. Thank you for joining us. Any other questions here?
Dr. Delahaye talked about, in some cases, somebody who has had exposure could still be working if they're essential. So I was wondering, what's some examples of that, and could that include somebody who actually tests positive, or is that just while you're waiting test results?
Well, there are sort of crisis standards, so to speak, where if there is someone whose contribution cannot be replaced, then we do have some special guidance for those who are asymptomatic but have tested positive to be in full PPE and only interacting with other workers and individuals who've also tested positive. And that's been utilized in a limited fashion in our Department of Corrections and also in some of our nursing homes. But our preference, of course, is if someone tests positive that they isolate at home for 10 days.
So like outside of a healthcare setting, are there instances where that doesn't happen?
Other than limited in the Bureau of Prisons, I'm not aware of any. Dr. Delahaye, Dr. Patil, are you familiar? Okay. I know in other states there may have been settings where that occurred in the meat processing industry, but to my knowledge that's not been used here.
We do allow asymptomatic workers who've been exposed or in quarantine to come to work. They're assessed for fever and so forth.
Yes, there's right. And just for the microphone, I'm going to repeat that. Yes, in some cases there's someone who has been exposed, and under normal circumstances we would have them quarantine at home. They've not tested positive, but in those cases we do the symptom checks and take precautions, masks for source control. But that's, again, the first choice would be to quarantine at home.
When it comes to the directives, what has enforcement been like? Have you been issuing citations, notices?
Well, in our regulatory functions as the Department of Health, what we normally try to do is to work with industries to help them come into compliance. Our goal is compliance, not punitive measures, and so that's the stance that we've taken with this as well. We really only resort to punitive measures when there's a clear refusal to come into compliance.
And have you had to resort to punitive measures, maybe other than the temple license you've been here?
Really, it has been the exception. We've had, for individuals, we had some orders of isolation, orders of quarantine, but the only cease and desist order that we've had is the one that you've mentioned already. Any other questions remotely? Well, thank you all. Appreciate you being here.
Good afternoon again. I'm Dawn Scott in the THV 11 studios, and you've been watching Arkansas's Health Secretary, Dr. Nate Smith, holding his press briefing today. The governor, of course, is at the White House with a scheduled meeting this afternoon with President Trump. So we do know that there have been 80 new cases of coronavirus in Arkansas. One of the 80 was in a state prison. The rest are community spread. 1,044 active cases, and of those active cases, cases. 85 are in nursing homes, 315 are in correctional facilities, and 644 are in the communities. Dr. Smith says there have been 5 new deaths from coronavirus. 4 of the 5 were nursing home residents. That brings the state's official total to 107, and 79 patients are hospitalized, 16 of them on a ventilator. Dr. Smith did say that we are well on our way to meeting our goal of testing 60,000 Arkansans for COVID-19 here in the state of Arkansas. And so far, we've tested over 44,000 people. Yesterday alone, 4,396 test results were in with a 1.9% positivity rate. That is good news, according to Dr. Smith. And almost 4,000 people in the state have recovered. That is also good news. We are covering all the latest coronavirus developments here in the state, and we will have them for you tonight on THV 11 News at 5, 6, 6:30, and 10. You can always catch the latest on our website, thv11.com.